These are some of the best over-the-counter treatments for dry eyes. We have eye drops, supplement, eyelid wipes, warm compresses, and more. But with so many options, how do you know what actually works? As an eye doctor, I'll show you exactly what I recommend to my patients to treat dry, red, scratchy eyes so that you can finally get relief. Let's get started. First, we have warm compress mask. One of the first things you should do is to get a warm compress mask. Warm compression is essential for eye care as your oil glands live inside your eyelids. Over time, your oil glands can get clogged up, so we always need to find ways to help restore the oil glands. I always recommend using a warm compress to start eyelid care. There are lots of great options out there. We have those that you can microwave, like the Brooder mask or the Optase mask, and there are also rechargeable ones that you can buy online. All of these work pretty well, so just find one and see if it works for you. I've been recommending the Brooder and the Optase mask for my patients for a while now, as they can trap and keep heat at a safe level. I recommend using warm compress for about 10 minutes twice a day. Now let's talk about eyelid wipes. Now that we've taken care of our oil glands, we want to make sure that we treat any other causes of eyelid irritation or blepharitis. Eyelid wipes like this can help remove debris, bacteria, excess oil that can help contribute to blepharitis and dry eyes. Regular use can help maintain clean and healthy eyelids, thus reducing inflammation. There are some patients who suffer from Demodex mites on the eyelids, and these are tiny, microscopic organisms that live on the eyelashes. If that's the case, you want to make sure your eyelid wipes contain tea tree oil. With both antimicrobial and anti-inflammatory effects, tea tree oil has been effective in getting rid of these mites. I tell my patients to use it twice a day, wiping 5 times from nose to ear. Some of the more popular brands that my patients have had some success with includes the OcuSoft lid wipes, Systane lid wipes, and of course, these Optase eyelid cleansing wipes. The Optase one is nice because it does contain that tea tree oils. Now, let's talk about lid and lash cleansers. To further improve your eyelid care, take a look at these hypochlorous sprays. Hypochlorous acid sprays help with dry eyes and blepharitis by killing bacteria, reducing inflammation, and improving eyelid hygiene. As a natural antimicrobial, it targets staph bacteria and Demodex mites, which are the most common culprits behind eyelid irritation and meibomian gland dysfunction. Regular use can soothe redness, promote tear film stability, and support overall eye health. There are several different brands out there, including these. My 3-year-old son has been dealing with recurrent styes for the past few months, and we've been using the Optase eyelid spray with pretty good results. Now, let's talk about supplements. Omega-3 fatty acids can help with dry eyes by reducing inflammation and improving the quality of the oil layer in tears, which prevents rapid evaporation. They support meibomian gland function, keeping the eyes more hydrated and more comfortable. There are lots of great natural sources like omega-3 out there, like fish and flaxseed, but sometimes you can't eat enough. In that case, supplements can be a great option. I've been recommending the PRN Dry Eye Omega-3 and the Nordic Natural Omega-3s for my patients for a while. Now, we just talked specifically about omega-3 supplements, but there are actually supplements designed for dry eyes. One of my favorite dry eye supplements is the Blink NutriTears, which contains a blend of lutein, zeaxanthin, and vitamin D3. A clinical study found that Blink NutriTears supplements significantly improve dry eye symptoms by increasing tear production, reducing inflammation, and enhancing tear film stability compared to placebo. These work fast. Patients experience less eye dryness and irritation as early as 2 weeks, and when these patients were examined again at 8 weeks, they had noticeable improvement in tear quality, corneal health, and overall comfort. So we've highlighted eyelid care and supplements, but without a doubt, if you have dry eyes, I think the most effective treatment are artificial tears. Artificial tears directly replenish moisture to your eyes. There are several brands out there, but I strongly recommend choosing those that are preservative-free. I find that my patients need the artificial tears about 2 to 4 times a day. Again, any preservative-free option is great, but you typically can find Blink, Sustain, Refresh in every single grocery store or pharmacy. Now let's talk about hydrating eye gels and ointments. If the tears are working well, but you feel that your eyes become dry again, you might need something a little bit stronger and a little bit thicker. That's where these artificial tear gels come in. In fact, I love these for our patients with moderate to severe dry eyes. Please note, they are a little thicker, so they stay in the eye a little bit longer. But this can also cause short-term blurred vision because it is a thick ointment. For that reason, I do recommend using these at bedtime. There are lots of great brands out there. My patients have had success using Retain PM, also using Genteel, Optase ointment, and even the Refresh gel drops. Last but not least, there is one eye drop that I recommend if your only goal is to get rid of red eyes, and that's Lumify. Lumify works by selectively reducing the smaller veins in the eyes, thus reducing the redness, but it does not affect the blood flow going towards the eye. Other traditional redness relievers like Visine and Roto typically constrict both the arteries and the veins, which essentially cuts off essential oxygen to the eye. This can lead to rebound redness, and that's one of the main reasons why almost every eye doctor hates Visine. The other nice thing, Lumify starts working within minutes, making it a safe and effective choice for occasional use. However, there's one thing though. Lumify doesn't treat the cause of red eyes. It merely makes your eyes look white and clear again. To treat the cause of red eyes, remember, target the eyelids, consider supplements, and even those artificial tears. And that was some of my favorite over-the-counter treatment options for dry red eyes. Definitely give some of those a try, and please comment below and tell me what worked for you. If you want a more in-depth video about dry eyes, take this video right over here. Otherwise, thank you so much for watching. Please consider subscribing and liking the video, and we'll see you in the next one.